Welcome to the Pandemic Files podcast, hosted by Dr. David Adnero. With each episode, we will be exploring the unprecedented public health response and those involved in it. More information can be found at thepandemicfiles.com. You can also subscribe on your favorite platforms, including Spotify, YouTube, and SoundCloud. I would like to welcome Sarah Barry to the Pandemic Files podcast. Sarah is a registered nurse and an officer in the United States Air Force, serving in the New Jersey Air National Guard since 2013. She graduated from the Helene Fuld School of Nursing and has a BSN from Seton Hall University. She is currently working to attain a Master's of Science in Homeland Security at Thomas Edison State University. Sarah has served a variety of critical professional roles, including teaching tactical combat casualty care for the Air Force and as an infection preventionist in both the military and also public health services. She joined the Northern New Jersey COVID-19 Field Medical Station as part of the New Jersey National Guard contingent that were deployed to form the core of the medical personnel for this site. For her efforts, she was awarded the Army Commendation Medal in August of 2020. So Sarah, describe for me what the beginning of the pandemic was like for you.
It was so weird because I was away for the military the end of February. Mississippi, we had heard that there was the first couple cases. One popped up in New York, and I literally came home, and March 6th or so, the buzz was going on at our local health department. And it was kind of chaotic a little bit. Nobody knew what the roles were going to be, where we were going. So everything was coming in. So I sent my son off to live with my aunt and uncle just because I knew my hours were going to be long. So, the single mom, during this, he had very, very rough time as a child with asthma in the ICU. And as an infection prevention nurse, I'm reading all the stories and things coming through, the CDC, the WHO, and it was triggering me personally. Like, what's my kid going to experience? And being out in the community when everybody's starting, to say, I'm going to go stock up on toilet paper, I'm going to get this and that, and all these antibiotics. I'm like, well, I just, they both worked from home. So I said, I'm going to protect him, throw him in with them. And I was out and about, at the health department. And I literally got the call from my command and said, we need nurses to go support the state. And, with my backgrounds, they called me up and said, can you please come in? And I said, sure. I know I'm at my local health department. It's kind of disorganized at this point. So I wanted to help in a bigger capacity and see where my skills could have been used. So it was so traumatic for me at that point because they're like, okay, you're leaving tomorrow. And then literally 5 hours later, after telling my civilian boss I have to leave, they pulled back the orders and the dates. And they said, stop here. We don't have any further information. So I went back to my civilian job. And that happened about 3 times.
Really?
In the midst of March. So got that call, I guess around March 12th or so, the first call. So between March 12th and the end of March, it was 3 times going back and forth of, am I leaving? Am I staying? So that was rough because I couldn't get a stable, mindset of what am I going to do? Am I going to be here at the health department and the local facilities helping them, or am I going to be preparing for whatever's to come? Because we had no idea until the moment we stepped off that bus where we were going up in North Jersey. We had no idea what the mission was. They just said they needed nurses. So in that time frame, for my son, it was pretty unstable for me. So it was for him. And it was hard to say goodbye to him and then say, oh, here's 3 more goodbyes in the instance. It's not like you're deploying where you say your goodbye and you're off. So with that part, when we came up in the beginning of April, called up for the military and getting off that bus and sitting in a hotel in this waiting room, checking in, and there was, okay, well, we're not starting yet, but we want to process everybody. So there was a couple of us from the Air Force, but a lot of Army there, which was really cool. I never thought that I'd be working alongside the majority of them. And it was a little nerve-wracking. It's like, okay, nobody knows what's going on. So when that evening, when they did rally us up, it was really cool. We were all medical staff in one conference room, and I think there's about 40 of us at that time. And I love how we work as a military operation because the structure is so prominent because of rank, and there's no question, right? So everyone kind of the leadership level already knew their job in that, okay, we're going to take charge and this is how we're going to organize. And it happened so quickly. And then the roles were assigned immediately. So everyone went around the room, told their backgrounds. For me, being trained by the Air Force as an infection prevention nurse, my duty was like clear cut, I guess. And then we were sent home that night, which was like crazy. Yeah, so they're like, all right, everybody's going to go home and then we'll bring you back. So even though we checked in, so we went home and then came back 2 days later. And that's where it was starting. And I guess for those 2 days, I don't know if the leaders were organizing or I think they told us a little bit like, hey, we got to figure some things out now that we have roles and who's here. So I don't know if that's their mentality, but we were dismissed and then brought back. So that was probably the 4th time that I was released and then brought back within a month's time. So that was rough. And then once we got there, we met all of you, the civilians, which was amazing because there was only like 3 or 4 of you.
At that point, I think there were 3 of us. It was me, it was Patty, and it was one other person who was doing a lot of administrative stuff. That was it. That was the entire team that was sent from DOH, and none of us had worked for DOH for more than 4 days. Maybe not even. It might have even been 3 days. So,
that's crazy.
Right. And then, because you all showed up, and then probably around Thursday or Friday, I think, and then the rest of the civilian, we'll call them volunteers, they were paid, but the ones who were volunteering, they came in Saturday, Sunday for orientation. So that worked out nicely because I think it gave us an opportunity to start gelling with you all, and then kind of create what we thought the structure was going to be. And you all come with your own structure, which on a civilian side has a lot of pros and some cons because you got to figure out how to make that work.
Mm-hmm.
But I think that cohesiveness that you all had then gave us an opportunity to build the other roughly 100 people who were coming in from the civilian side into that structure. And of course, for Patty and I to find out that you were an infection control and prevention nurse was, amazing because that was going to be such a major part of what we were going to be dealing with. And we were fortunate enough to have really good supplies come directly from the federal government.
Yeah, I don't know if it was on YouTube or where I saw it, but before I was even called up, I think I don't know if you knew you were in this position, but as they were building this convention center into a hospital, I didn't think I'd be there, but I saw it on the news or somewhere with the Army Corps of Engineers coming through. I'm like, wow, that's pretty cool stuff that they're doing. And then we ended up living there.
Sure.
Yeah.
I was like, when it was first described that they're starting these 3 things in New Jersey, which are going to be hospitals in a convention center, I thought that there was going to be, they were coming with an entire kind of like some civilian military version of a MASH hospital with personnel and everything else, and I would be helping out. I didn't quite understand that it was kind of a build your own sort of kit, where, not only were batteries not included, but personnel was not included. So, or medications or wraparound services. So I give the OEM folks a lot of credit that they got 98%. I mean, 98% of what we needed was there. There were some things we asked for and we had to flesh out, but in terms of equipment or wraparound services, it wasn't like they'd ordered an MRI machine and we didn't need one, but they didn't have any oxygen. They had really thought of everything and really had gotten most of it set up in terms of the physical plan. So I
was very impressed by how
Yeah.
close they got to perfect.
The thing, when I knew I was in this position, and, I wanted to look at the layout of this facility, and that's so important in infection prevention. Infection prevention nurses, especially those that are certified, I never went for that, but because I wasn't doing that full time and only in the military. But when I saw the building, it was amazing where they chose and whatnot. But it was so quick, like the setup, the footprint, and the FEMA, footprint was for an emergency, a national emergency. But I don't think, and I'm not sure, that they considered a biohazard type of emergency. So having supply go through, our EOC Operations Center, for all of us, in the front of the building was great. So when you come in, you get ready for work just like you do in a hospital before you go in the OR. But it's like, okay, I'm going to walk through the OR to get all my supplies for surgery, but I'm decontaminated to bring it back in. And with how the center of the patient, being, between our operation center and then supply area in the back, and having to go through back and forth, that was like triggering to me as a nurse, and say, like, how are we going to protect those of us who are up front, that need supply in the back, but we're going through the hot zone. And so, in our debrief, that was the one thing I would have recommended, going forward, that we prepare operation plans more for those outbreaks. And I hope they look at that for the future. They had to do with what they had. And just having a medical consultant come in, because I don't know how much FEMA brought those types of people in to set up the facility. OEM probably doesn't have those types of consultants with them. But going forward, I highly recommended that. Just have someone to see, okay, are we going to be cross-contaminating? So, and then, of course, our hand washing stations too. That was so fun.
Yeah. Right. Yeah. And I think this is where they built a footprint that I think was pretty effective, and really immediately, starting with Patty and I, and then when you and the rest of the National Guard medical leadership started fleshing it out. And I remember, I think one of the first conversations that you and I had was essentially, we have a hot zone where people have to be fully in PPE and protected, which will be the patient care area. We have a cold zone where people are coming in, which includes sort of, where people were changing, the command center. And cold's a relative term because we were still having to do distancing, et cetera. But you pointed out there was no transition zone. There was no worm zone where people would be switching out PPE, et cetera. And we really, I think, ended up within a day or two, you all created that worm zone, which was the rooms that we could hang, when people were recycling masks and gowns, that ability to have that space between where people would be eating lunch and where the patient care was, we needed that transition point. And I think that was really one of the first conversations you and I had. And that was so critical because as soon as you said it, I'm like, yeah, I agree completely. And I think we ended up taking out the equivalent of about 10 beds worth of space in order to create that, transition zone. And I also remember having a conversation about sinks on either end of the hot zone, but none in the middle of this large.
Yeah, and they did it within 5 hours of us getting the first patient.
So now going back to the beginning part, how long had you been in the Air National Guard when 2020 came along?
So I joined in 2013, so it was 7 years. Yeah, 7 years, and I did multiple roles as a nurse in the Air Guard. So I started off as the infection preventionist for our wing that we worked for, which was great. It was clinic-based. It wasn't really hospital-based, but we had to assume all the same patient safety goals and all of the cleaning materials. We had every checklist possible that I learned. And so I did that role for 3 or 4 years. And then they moved me into teaching combat trauma for the whole wing. So I got a really good footprint in that position. And during that time, I worked for the county health department in the civilian role. So that's what I love about as a nurse. I get to do both. I'm not just active duty and I'm not just a civilian. So in the National Guard, it's such an awesome role that you can serve your civilians and then your military, call up to either or. But then we also got, as military, we got to serve our communities. It gives me goosebumps now just talking about it.
Yeah, and from my point of view, my father had served in the military. My brother, as a chief warrant officer in the Army Reserve, has been for 25 years. I had never served in the military. And universally, as I talk to the civilian side, the opportunity to work with you all is one of the highlights of their experiences in the field hospital. Because you don't get to be around people in uniform very closely, much less see them in operation. And, universally, I think everybody saw that as a privilege that they got to experience the field hospital. I also think that we all recognize that while we were all at the field hospital, things were a little bit different. All of the civilians were volunteers, but they got to go home every night. And, they may have been social distancing from their families, etc. We recognize that as military personnel, number one, you all weren't getting to go home every night. You were essentially stationed in base as if this was a deployment. And number two, whether or not you volunteered or not, you were required to be there, that you had, already decided in your life that you would make yourself available at a moment's notice to protect and defend our country. And this was, while an unusual role, I think, for you all, this was very much protecting and defending. And I also have to say, I was always impressed by how, besides the teamwork and structure you brought, the baseline assumption that you have to take care of your soldiers and your people and your airmen.
Yeah, I think you hit the nail on the head. Like, you think back to the Revolutionary War and, most of the men, the troops, they were dying from hypothermia and infection.
Yep.
And I think the leadership back then, they realized, hey, we're not going to get through this unless we take care of our own people. And it's so basic to study history and why it's so important. And that role that coming into this, for me personally, like, I took that to heart. And, one of the first deaths in the state of New Jersey, I believe, was a National Guardsman who was a doctor. And when I read that, before I even started this role that I was in and this mission, I took that to personally. And I don't know, I had heard of this person through friends that through the military system that he had passed away. And when I came into this, I said to myself, there's no way am I going to let any of my guys get sick. And if that meant them not liking me or anybody, I was going to be like that name out there, that nurse over there. But I did a lot. And I have to say, it was a struggle for me. My favorite part was being physically at the site. When we were released to go back to our hotels to sleep, I didn't sleep much. I was up studying this virus and trying to figure out what's the next step, because I felt like that was my role, and who else would get the word down to us. It could have trickled through the epidemiologists at the health departments, but I wanted to be versed for us on the ground. So I would stay up after getting off of hours and read and see what's the next thing coming out. So yeah, I did that mostly with our troops in mind, first and foremost. Secondly, the civilian workers, and working alongside you and Patty was amazing. Sorry, I came at you guys a couple times. My apologies now. I'm really a nice person, but I will advocate for what I truly believe in.
Well, I think everybody was under stress.
Mm-hmm.
And the trying to integrate, even for Patty and I, the who's in charge part, what's our role, because you guys came in with a set structure that made a lot of sense for you all, that we came to see as very valuable. There were the Office of Emergency Management folks who were sort of like almost like our landlords, and we were their tenants. So, we were running them for things we needed. We had some supervision from the Department of Health in terms of the overall mission. And so a lot of the stress for us was the integration. And for people who don't do medicine is a contact sport. And people advocate all the time for what they need for their patients. And you advocated very strongly for what you felt we needed. And you were correct that for the vast majority of it. Sometimes it was trying to figure out how to implement it. At the same time, I had no doubt that if I was not going to agree with you, I had to have a good reason not to agree with you, because you were the expert. And that was one of the privileges of having you there, was having an expert in infection control and prevention at the site. And I think, it seems like it was like the first few weeks that there was some tension. That was really the first few days, because a day was a week was a month. And I just appreciated the fact that you had a point of view and you're advocating for it. And that's the part I will always be happy about. I was also happy that we were able to, quite frankly, as an example, you and Patty training essentially what would become the housekeeping staff, who had never done any form of healthcare cleaning, much less the type of cleaning that's required during a pandemic. So yeah, there were times where there was some tension, but I think it feels like that was the first few weeks, but that was really probably the first 3 days, because after that, everything started to, get back. And your tenacity became incredibly important as you took on other assignments outside after the field hospital, when you did work for the Department of Health and with the military and some of the, assisting DOH and other nursing homes. That was incredibly important. You made that clear from the moment you walked in, that this needed to be the first thing we thought about during every single interaction, that you could do nothing with a patient without first thinking about infection control and safety.
Thank you. I appreciate that. And, just the kudos for infection preventionists. And it's a one-man army, typically, literally and figuratively. I think the unsung heroes of this whole entire war, and I do call it that, our medical war, was the EVS environmental systems. I can't, like, it chokes me up a little bit, and I don't cry. So, sometimes I can come off as a harsh one to certain people. I did cry 2 points during the whole pandemic. Like I said, the one time I came home on Easter, I was alone. So, and I do have that on my video journal that I have. And then the second time was in the hotel room when those environmental services people came in, where we couldn't get anybody, if you remember, in the beginning.
Yeah.
And it's like, what do we do? Like, oh my gosh, here's another wrench in the car that we have to leave. And this business office service said, oh, we can do it. And these people came in with the biggest hearts and open ideas and just said, we're sponges. We'll soak up with what you teach us. And seeing what they were working with, I advocated, I remember we need to get them more protection just because of what they were doing. And I don't know if everyone in the world understands how important those workers were still to this day. They were so kind and so like, we'll do whatever you need us to do. And they reminded me of my troops a lot. Like, being a civilian, you delegate to certain degrees as a nurse, but you always have to go back and double check, make sure they're doing their jobs right. As a nurse in the military, I feel confident where they want to, my enlisted and other officers and myself, to my superiors, you don't want to let them down. I don't know what that feeling is that we have, but you get a job, you're told it, and you do it. You don't question it. You go in with all your heart and soul to do that job and complete the mission. And I felt like those EVS workers, they were similar in, hey, we're going to do whatever you tell us. We might not have that experience. We don't know how to do this and that, but they learned how to don and doff PPE correctly, and they learned how to clean correctly, and they if you remember the one incident in the bathroom that they had to jump in hazmat suits, and they did it without complaint. It was just amazing. It was so amazing.
And I was impressed. I was impressed by almost all of us that were there, whether, even on the civilian side, healthcare providers assume a certain amount of risk. We understand that may not be as large of a risk what the pandemic would bring us, or if you're facing, God forbid, Ebola, things like that. But healthcare has certain number of risks. And for these, this cleaning service, these employees of this cleaning service, they were an executive cleaning service. They cleaned offices. Mm-hmm. And the fact that they volunteered to do this and were willing to do this and were willing to learn and did a fantastic job and became part of the team was amazing. Because, and over again, watching people be willing to take on a certain amount of risk because it was the right thing to do. So many of the people I've talked to essentially went, I couldn't imagine not doing this. When I heard about the field hospital, people would say, I couldn't sit on my couch knowing that there was an opportunity to go there and help other people. And they all, I think, recognized that there was some danger. We didn't know, we saw healthcare providers dying. We saw healthcare providers getting sick. And yet people still came. And I am always impressed by people's willingness to risk their own health. And this is unusual in healthcare, this level of danger. I think the military, you all accept a certain level of danger and risk. But that's, in civilian medicine, most of the time, yes, there's a lot of things in the emergency department can hurt me. But in general, I believe thoroughly I'm going to come home from every shift and not be physically. I wasn't sure that I wasn't going to get sick in the field hospital. Worse yet, and this was, Patty said this very well when I first interviewed her, the fact that nobody got sick and nobody was injured is the single greatest accomplishment of the field hospital. And then close second is the fact that we cared for people who needed to be taken care of, who needed to get out of acute care hospitals that were overwhelmed. And, directly and indirectly, lives were saved because of what we did. But the fact that nobody got COVID of our staff was incredibly important. If you don't mind, for the people who don't understand sort of what this entailed, do you want to talk about essentially what a healthcare provider or anybody who was working in the hot zone had to do to enter and then leave the facility, including if they were going to use the bathroom or they were going to eat lunch? Kind of talk about the gowning up, the donning and doffing, as we would say, and how complicated that was and what people were wearing while they were functioning for a 12-hour shift.
Yeah, I can go through some of the steps. So we knew coming into a facility that you're bringing whatever in with you, and you needed to get rid of it. So double checking, walking through that front door, there were civilians and then there was military. So we all had a uniform somewhat walking in. And or you had to bring an extra set of clothes with you. And we learned that within like a week, I think, of us opening. And I remember where we had a station at the front of the opening of the field hospital where we staffed some of the Army. I don't think they were medics, but they were logistics. So they were just people that counted supply, and they were put on the front line there to check everyone walking in. And if you remember those days, just in general, you get your temperature checked. You have to wash your hands with hand sanitizer right as you enter. And we did have a couple that they would spike a little tiny, temperature, 100 or so. And we were going by the CDC guidance, like 100.3 at the time. If you hit that, and you're flagged. And we would see that every now and then put them aside. But they never, and we would test at that point if they had it, and we'd send them back. But no one ever came positive from that. Some people were drinking coffee before they got their temperatures taken before walking in for work that day. But then walking through that first set of barriers, I guess you could call it, the second round was to either change into your work clothes. And we did learn at that point we needed a changing area. If you remember, we needed storage for everybody to put their things in that they were bringing in. So we made right off the front door the changing area for all of the workers. So they would either change into their work shoes that they brought in, or we would have an area where they would clean their work shoes before walking out from the end of their shifts. So I remember in orientation saying, hey guys, if you want to, this is just, best practices, bring in a pillowcase with you. So at the end of your shift, you had your clean clothes, and then you would change from your dirty clothes, throw it into the pillowcase, put in a plastic bag, and then change into your clean clothes to leave work. And when you get home, you take your pillowcase out with your dirty clothes and throw it right in the laundry. So these little tiny things that you don't think would help, and it's so basic, that was a huge piece in prevention. And I think why people didn't get sick. Cleaning off shoes or bringing in different shoes, and then changing into a different set of clothes. So when the shifts would start, we needed to determine, hey, how are we going to use the facility that we had and the setup to don and doff our PPE, and then also between the zones. So like we established a warm zone after the hot zone. So in the cold zone where we would hang out, get our little breaks of air that we, after taking the N95 and, your distance and pulling it away, we had some tables set up. And in that area, we had a ton of hand sanitizer, thankfully, but we were always washing hands. Had signs we made, how to wash hands, how to don and doff PPE, because even as healthcare workers, you can get complacent after doing it so long, but we had to have these visuals as reminders. Exhaustion can set in at times, and if you miss one, that's how you contaminate, is if just that one little instance, I did this wrong, took my gloves off, after taking my mask off, you can contaminate that way. So making those signs, and then where are we going to store our N95s? Because those were our bread and butter, I guess you could call it, of protection. And we did not want to run out. So with all of the savoring of the PPE, I remember in the beginning when I got there and watching it dwindle quickly, that somebody needed to jump in and help preserve that. So one of my medics, we got in, and she was in charge of the safeguarding of that PPE. So after you get your N95, you're in there, you put your N95 on, double mask with a surgical mask on the outside of it. That was your protective barrier to your N95 that you could reuse for, I think it was 24 hours that we were, I can't remember the details, but we were preserving the N95s because at the time we were going by the guidance of the CDC, these could be reused. And so we had a PPE closet sign out log, so we could track how much was being utilized by one person. Are they using too much? Are they getting, too contaminated? It was great data that we could use in just in time during the field hospital. And then once you're PPE'd up with some had hair covers, you had your mask, eye protection, we had our gowns, gloves, and booties. So it was interesting to have civilians who were retired coming back into the medical field retraining that way, and watching them putting on and off. They always said it was different from years ago, but a lot of it came back to them. So just retraining that. And then once they're ready to go into the hot zone, as long as you are, gowned up, everything, you have a buddy that checked you, make sure everything was on correctly, and you were able to enter into the facility. So anyone who worked in the hot zone area had to have full on PPE. Behind it was the logistics area, and it was curtained off, and those who were not in any type of role to serve clinically, they had to have a double mask and lots of hand sanitizer. So that was pretty much the overview. And when leaving, again, just walking out, you're going to the warm zone that we created before you walked into the cold zone. You have to doff, which is taking everything off of yourself in a correct format, or you could contaminate easily. So having a buddy there watching someone and say, hey, don't forget, and looking at the visuals of how to do that was so important. So yeah, everybody did a great job. And there was a couple people that if you did get called out, they were a little upset, but no one got sick. So I think that's important moving forward, that we help each other in even just the littlest simple ways of medicine, and reminders to each other. Like, let's do this right. Let's protect us so that you can come back the next day. Yeah, we did it pretty strict, and the data shows itself that we did it right.
And just so people understand, when somebody was finished donning all of their equipment, what would they be wearing in total? So people just have an idea of how the healthcare providers were spending their 12-hour shift when they were, doing patient care.
Sure. Yeah.
So they'd have their scrubs. They'd have scrubs on. They'd have an N95 mask on as basic. They'd have gloves on most of the time. And what else were they wearing at that point?
We had eye protection, so either the built-in one on with a plastic shield attached to the surgical mask. So the N95s, we all would use a surgical mask that we would toss after every shift. So we were double masked. Some had decided to wear hair covers if you had them, but we were going through those quickly, and the booty covers on the feet, we would go through those quickly. And I think if we were cleaning our shoes, we decided we didn't need those at the time. So if you're cleaning your shoes before you left, or taking them off and leaving them and going into a cleaner pair. But yeah, basically it was your N95, which was our gold standard, with a surgical mask, a eye cover, either goggles or the face shield. With that, your gowns, your gloves, and then optional, your hair cover and your booty covers.
And these gowns we were fortunate to have essentially the gowns that are worn in surgery. So these are heavy. I mean, they weigh less than a pound, but they're heavy. You can get very hot in them. They're somewhat restrictive when you're moving around. So people were really, this impeded conversations. So people didn't tend to talk unless they needed to, because you found yourself always shouting, so people could hear you above the noise, and also through two masks. And inevitably, the mask through your eye cover was somehow, or your hair cover was usually covering your ears somewhat, so your hearing was always a little bit changed. So, people were working for 12 hours, and anytime you had to go to the bathroom or you took a break to eat, you had to come out of most of that in a reverse fashion that was safe, and then wash up, and then when you were done, come back and do that whole process all over.
That was the most difficult and trying for everybody. To take a break was like going to Disney World. It's like getting out of everything, getting some fresh air. If you could go outside, that was a treat. But people hated it because you had to do that all over again, and it was so exhausting to go through those steps just to use the bathroom, to have lunch if you're going through that. The other thing that I remember, I was looking for someone in particular on one of those days, and I couldn't find them. And I said, I don't know who's who, because we can't see who that person was. And I said, I put on my gown, my name, and on the front and the back, kind of like what we do with the military, like, because we all look the same. We're all uniformed. And that's why we wear name tape, so that we can distinguish each other by your name. And that was the norm after that. We all started writing our names, and so that we could see who was who, and if it was a doctor or nurse. Especially, I felt so bad for the patient to see, these strangers. You can't see a face, you can't see a mouth, and there was no personalization. And I think eventually some people started putting their picture of what their actual face looked like a smile stuck to the front of their gown, so that it was a friendly face, that, hey, I'm not I'm not like this villain from Disney movies. I actually am a human underneath of all of this, and I'm here to take care of you.
Yeah. And again, you're pointing out this was a really austere environment for the patient. You had essentially a military cot. You had till we got better beds that were ordered by the Department of Health. You had a metal folding chair in your room. You had a light source. You had some place to plug in your phone. And if you're lucky enough, the Wi-Fi was really pretty good there. But that was about it. And you weren't really allowed to wander around unless you were going to use the the restroom. And most of the patients were too debilitated really to get up and walk around. And then the people who were taking care of you looked like something out of a space movie. It just added to the isolation that I think the patients were also feeling at the time. Though all of them were very happy to be on the mend and out of an acute care hospital. Oddly enough, even in that austere environment, we had staff that was totally dedicated to them. In hospitals, unless you were really sick in a hospital, you weren't getting a lot of care because they had to deploy their resources and their time individually to the patients who were far sicker. So, we had a lot of patients who, with just some normal basic nursing care and oxygen and physical therapy, really improved greatly in a short period of time and were able to then safely go home. But there was also a little bit of an advantage to the anonymity. One of the things that I think really worked well in the field hospital is the authority gradients were very flat because nobody really knew who was who. And so I think instead of having as much hierarchy when it came to physicians and then nurse practitioners and physician assistants and nurses, everybody felt kind of equal in a lot of ways. And that led to a lot of collaboration.
I think the people that wanted to do this, and I'm going to say the ones that showed up and wanted to do this, I don't know if I didn't know what I was getting into, but walking into this, everyone knew, like, it didn't matter what your background was, what your education was. I saw a doctor getting the deliveries of the oxygen tanks and setting them all up. And typically you don't see that at all. Like, they would never do that in the hospital. And, I had some physician's assistants helping me change out the system of how we delivered the lunches because of cross-contamination, where we had a cart at first rolling into each little area with all the lunches on it. But over time, I said, that's not conducive for this environment. Let's bag up the lunches. If you remember, we were like, where do we get all these paper bags to put these lunches in and then deliver them one by one to each patient into their little area? So everyone jumped in and just helped where they needed to. It was super cool to see that.
I agree. Now, when we started, you were talking about probably a week or two after the field hospital opened, getting to go back home on Easter, concerned about, the condition of your property with the storm, but also sort of how emotional that was to step out of the environment and back into your, quote, normal civilian environment. But I don't think you got a chance to finish that story. So what was that like, and how was your son doing at that point?
So driving home, it was a crisp, I'll never forget. It was a very beautiful blue sky, crisp, chilly day for Easter, but definitely not a winter crispness. It was refreshing to be outside and to be able to drive home. And when I got home, I had no idea how I would feel. But when I got to see my son, it was heartbreaking because he sat on the floor to the front door of my aunt's house, and I sat outside on the step, and we touched each other through the glass. We held our hands up and touched that way. It broke my heart to not be able to touch him and to hug him. And, I had been gone away from him for, at that time, almost a month now, between being in my civilian job and then on orders for the week. And so I had brought him an Easter basket. I left it out on the front lawn, and I had to step away from him. Like, I stepped across the front lawn area on the sidewalk. He came outside with gloves on. And he got his Easter basket. And, looking back, I'm like, wow, we really did all that stuff, but we never knew what we were getting into. And it was so dehumanizing to me to, like, what am I going to bring home to him? And I can't be a mom to him at this time as a single mom. And I left him. I have it all on video. I still have, him opening his Easter basket. He was a young little tyke at the time, a preteen, like 11 years old. And he didn't know what was going on. Like, he grasped it, thankfully, at that age, that mom's at work. But he was also, like, hearing things at that age, like, he was scared of me too. Like, and it broke my heart. So I came home and I took some time for myself, and I started a video journal, and I let loose a little bit in that journal. And I saw some of my neighbors walking around on the streets at the time, and I got emotional about it, hearing all the deaths and things that were going on. And there was a lot of political talk of who's on whose side. And it just got to me at that point that, we're out there fighting the fight, and there's not a lot of control. Now, with military deployments, if you're away for a certain amount of time, we didn't know how long we would be gone. Usually when you're deployed, you get a stop date, and you know when you're coming home. And at that time, we had no idea what was going to happen. The other conversations we had as military were, when you're deployed overseas, usually you're giving a preparation time to set all your assets up and say, okay, I need to get this in order before I leave. And when you leave and you go overseas, your main focus is on your job. You're not typically, there's certain things, but you're not typically worried about life or death of your family at home, because we're in America and we're used to that. We're safe here. And you only have focus on your job overseas, and you're, 4,000 miles away, and you're seeing each other, you can, through video in these days. But in this instance, I'm 2 hours away from home, right? I'm up the road on the turnpike. I'm 2 hours, 3 hours away from home. I'm so close, but so far away, and so far away that I can't even touch my son, who's just a couple hours away. It was so devastating to do that, and to worry, about, was he going to get sick? And I'm out serving, sick people already, and our roles were limited. If he got sick, could I leave to come home while I'm helping other sick people? So that was the scariest part for me, and the most emotional, was being so close to home, not being able to touch my child, and worrying about his health and safety. When you're deployed overseas, everyone's just here in America, and we take for granted what we have. But at that point, anyone, it didn't matter. This virus didn't choose what country you're from or what your socioeconomic, income was, and anyone could be affected by this. So that was the emotional part, where we were so out of control at that time, we couldn't control anything.
And your son remained healthy during the pandemic, doing well now?
Oh, yeah. He never, the homeschooling, and he had excellent family taking care of him. Thank goodness for video calls. You're not doing handwritten letters like World War II used to. And we stayed in touch, and he knew I was safe. So he was very concerned about me. And his dad's a nurse too. So, even though we were not together, he had two parents on the front lines at that time. And emotionally, he was worried about us. So it took a toll on him, and the isolation as an only child at home. He had no one to play with for that time. And, I worried about all that stuff. And so on top of doing my job away, what could I do to make sure he's getting his education still, and is he staying healthy and mentally, physically? So it was very draining me physically, emotionally, mentally.
So I think we're going to try to wrap this session up, though. I suspect you and I are going to have another session to talk about DOH stuff and all the work that you got integrated into and led around infection prevention, and particularly around nursing homes, etc. But, one of the things I've been doing during these podcasts is kind of asking a series of questions, kind of reflective questions at the end. So the first one is, how do you feel about your time specifically at the field hospital? Looking back, what's your general feeling about those, what turned out to be about 4 or 5 months of your life?
I would absolutely do it again. It's hard to say, like, there was death and destruction during the whole pandemic, but the exhilaration of, hey, we're doing something really cool. It hasn't been done for a couple hundred years in the healthcare field. Like, we're going down in history here. Who knows? We might be part of history books. And I would definitely do it again to hopefully, if it ever came to be, to make some changes too, since we have been through it, for the future generations. Yeah. So.
And what impact do you think your experiences have had on you, both personally and professionally?
In general, I definitely have made decisions personally of where I want to work. And definitely, I did step away from that role for a bit because I did feel burnout, I have to say. And I was angry at some point during it all. And those are things that I'm working on for myself. The pandemic's over, but the continuation of the virus is not. So we're still learning the healthcare system in general. And, I thought, and reading the history of the Spanish flu and all of that, there's just tidbits. And I think with the technology we have today, there's going to be more information for the next round of people that they can look back and say, wow, it's year 4 and it's still happening. And I don't know how long the residual from the Spanish flu lasted, but in the acute phase, I think it was like a year, 2 years where they were figuring things out, but the long lasting effects. And I'm like, when does it end for us? When does this end? And that's the hardest part and the most emotional piece for me. We're still in my current job, my civilian job as a school nurse, it's like still got a stronghold on us. And that's the hardest part for me. And the decisions that I'm making is like, do I want to stay in nursing at all? And, I'm back in grad school right now doing non-nursing stuff. And just to have options where I think a lot of people have made these decisions of like, what do I do with the rest of my life after this? Because it definitely was not this feeling before it.
Yeah. What are you most proud of?
Most proud of is, I would say that we as humans came together from different areas of backgrounds, cultures, medical training, civilian work, military work, that no matter what our training was, we all came together and we got a mission done. And people in our realm of the field hospital fared out pretty well. So I'd have to say, just as individuals coming together as a whole and working together is what I'm most proud of.
And finally, do you have any last thoughts or any questions for me before we finish up?
I would, no questions, because we talk periodically, and I'd say, I'd love, even with the hotel staff, like we talked about, we became friends with the hotel staff that we were staying with, and they were doing our laundry for us and taking care of us with food and all of that. I would love to have, and I don't know if we can, a reunion.
I'm with you 100%. I think we figure out something. I get to talk to you, obviously, and some other people, but I'd love to be able to reconnect and just thank people for everything they did. They were just so impressive.
Yeah, and the Air Force side, I get to see a lot of my colleagues. The Army side, the civilian side, I don't get to see anybody, and I'd love to see where everyone's at now.
Yeah. So, first of all, Sarah, thank you for agreeing to do the podcast. Thank you for being your authentic self during this podcast and sharing kind of what you've gone through. I appreciate that. It's not easy sometimes to be vulnerable, but I think it's important that people understand that regular human beings who are under a considerable amount of stress did the things that we did. And thank you for all you've done. You spent as much time as I did actively with the Department of Health and the military responding to the pandemic. That was a long couple of years. And thank you for your service to our country. I mean that sincerely. And I really appreciate having you as my friend. That's been one of the highlights of the pandemic, is that be in contact with people that I never would have gotten to meet otherwise. And, I want you to continue to be safe and do well and thrive, because you and all the other people who did amazing stuff deserve it, without a doubt.
Thank you for being our fearless leader, honestly. I really appreciate it. I'm not going to, rehash what you said, but ditto, Dave.
Thank you for joining us for The Pandemic Files, produced and copyrighted by Griffin Medical LLC. For more information, please visit our website at thepandemicfiles.com.